Good afternoon. Let's talk about ankle sprains and foot fractures now. A lot of time patients come in and say, hey, doc, I have an ankle sprain. And it still hurts. It's been 2 weeks. I've been able to walk on it, but it hurts and it's very swollen. Now, first of all, an ankle sprain, the definition of an ankle sprain is injury, injury, miniature rupture, or even rupture of ankle ligaments, usually on the outside, on the fibular side. This is the foot, big toe, fifth toe. Outside is the fibula, the other side is the tibia. Usually you twist in this way. So you have 3 ankle ligaments. On my ankle sprain video, I talk about 3 ankle ligaments, 1, 2, and 3. Now, particular, this one video, we're going to not rehash the ankle sprain, but we're going to talk about the common foot fractures that are associated with ankle sprains. Believe it or not, a lot of times when people sprain their ankles, they come in and we actually find foot fractures. That's why we take foot and ankle x-rays for these patients. Even though they may say, oh, I went to the emergency room, or I went to the urgent care center, or even I went to my general doctor or orthopedic surgeon and they took ankle x-rays, everything was negative. I still take the foot and ankle x-rays for my own sake. Number one, because if you have a stress fracture, it may not show up for 2 to 3 weeks. And if you go in a chief complaint of ankle sprain, unless you're a specialist in foot and ankle trauma or a specialist ankle doctor, specialist from a podiatrist standpoint dealing with foot reconstructive and ankle surgery, or if you're not a foot and ankle orthopedist, a lot of times we neglect the foot fractures. So let's talk about the common foot fractures now. I have marked here, as usual, my electric tape. Now, this is a common mechanism. Big toe on this side, fifth toe. So this is the common thing. It's called an inversion sprain. Your foot is going to go like this in your ankle joint. And these are the most common areas that I'm gonna point out for you. Number one, this is called a fifth metatarsal base fracture. I'll show an X-ray of that with an actual patient later. This is called a Jones fracture. Sometimes in the emergency room or emergency physician will think these are the same. The reason why it's important to us as a specialist is that they're treated differently. The time of recovery is different. The threshold for surgery is a little bit different between these two different fractures of the fifth metatarsal bone. Yes, they're on the same bone, but the healing time for this is a lot longer than healing time for this. So the threshold for surgical fix of this is a lot lower. So this is the heel bone. No, this is the cuboid right here. Can't see it this way. So this is a cuboid fracture. Sometimes, on a rare occasion, people do get crush injury of this bone upon the ankle twisting. You get a little crush of this bone. We call this a nutcracker fracture sometimes, because in essence, these bones together are crushed against this middle bone right here during that twisting injury, especially if you step into a hole or a rock and cause that little inversion. Now we're going to look at this one. This is the calcaneus bone, the heel bone. This is the anterior calcaneal process. There's a little horn that comes in front right here. The pattern on this bone, I'm going to show it. Like here you see it's like a little horn that's called process. The little horn in front of the calcaneal bone is called a horn. We see that fractured a lot during an ankle sprain because there's a ligament that runs from here, calcaneocuboid ligament right here, that goes ahead when you twist and turn. You can go ahead and pull this piece of bone out. So that could be a little bit of a problem, pulling this bone off the main body of the bone. So let's talk about each individual one. With this particular fracture, fifth metatarsal base, the treatment for it is, if it's not displaced, we don't really fix it. If it is displaced, then we'll put a screw in it or place or a plate with screws. There's many different ways to fix it. This one, if there's any displacement, if there are any displacement with this bone, we go at this area, we go ahead and fix it with a long screw, usually a long screw in the shaft, or placed-in screws are acceptable too. This bone rarely requires a surgical intervention because it's a flat bone. It really doesn't go anywhere during that crush injury. But occasionally I have seen pictures of people putting placed-in screws on here if it is displaced or crushed enough. That has to be a pretty traumatic injury. Now we're talking about the anterior process. The anterior process sometimes requires surgery if A, the patient continues to have pain there, or B, if the fracture is greater than 30%, of the joint, of the calcaneal cuboid joint, then we go ahead and either A, take off the fracture segment, or B, sometimes we stick a screw down. We don't see that happening too much, but the rule is if it's greater than 30% involvement of this fracture with the joint, if it's down low, then indication is to go ahead and fix it or remove the fracture fragment. The other option is wait until arthritis sets in this joint and do a primary fusion. That's another option too. So there are many options to fix this. But the point of the matter of this video is to show that you can have a lot of foot injury, foot fractures associated with ankle sprains, where the ankle ligament, yes, you might have sprained or have small little ruptures of ankle ligament that may not require surgery to fix, but you have these foot fractures that need to be attended to. So hopefully once you present to an urgent care facility or to your primary physician, they do take an x-ray of your foot in addition to your ankle to make sure that your foot is fine from this ankle sprain. You can see there's a lot of things that can go wrong, and these are the most common things that can go wrong in the foot after a ankle sprain. This x-ray goes and shows the fifth metatarsal base fracture. As you can see, the location of the fracture where I have circled in a gray charcoal. This requires surgery because it is fractured but also displaced. This is the same fracture fixed with a screw. As you can see, there's no more space in between. Same patient. This is a patient with an anterior process fracture of the heel bone. As you can see, I have an arrow pointing to such.